Content warning. We want to acknowledge that today's topic is sensitive and potentially distressing to listeners, with references to suicide and mental health struggles. Please take care of yourself as needed, and you can refer to the episode show notes for supportive resources.
In our latest episode, we are finding the baby and risk factors contributing to the rising rate of Black youth suicide. Listen to Get on the Early Childhood Bus wherever you get your podcasts. Hey, Atina.
Hey, Penny.
Welcome back.
So good to be back. How are you doing?
It's been a very long time.
It's been a long time, and many things have happened.
Welcome back, audience, to the Get on the Early Childhood Bus podcast. Heck yeah. It's been a while since we recorded last. Today, we're going to talk about some mental health. Is that okay with you?
Absolutely. Let's talk about it.
We had a one Erikson. And one Erikson, for the audience who might not know what that is, it's when all the staff and all the employees of Erikson comes together. And one of the workshops that we had during that was about mental health. It was about youth suicide, Black youth suicide in particular. We had staff come in and talk about, just go on and on about how impactful that workshop was. So we invited Tandra to present to our summit because in line with the whole mental health theme,
yes,
we wanted our summit to kind of keep with that theme.
Before we dive into that, I would like to orient our listeners to who is Tandra. Tandra Rutledge is a nationally recognized mental health advocate and suicide prevention educator with over 30 years of clinical expertise and organizational leadership. As the founder and chief transformation officer of Avidity, LLC, Tandra provides consultancy services to design and implement sustainable change, specializing in integrating faith, social justice, and racial equity into mental health initiatives with a focus on Black communities.
So let's jump into what we learned and what we got out of that summit by starting with the recording of her session with the fellows.
This clip features mental health advocate Tandra Rutledge addressing our Early Childhood Leadership Academy community at our 2025 Summit event.
In 2023, researchers from Johns Hopkins renewed this urgent call to action in a report called Still Ringing the Alarm, an enduring call to action for Black youth suicide prevention. The second report emphasizes the need to examine socio-ecological factors and structures, including institutional racism. Thank you, Penny, for Jeopardy, for the Family Feud game. The socio-ecological factors that contribute to suicide risk among Black youth. And so today, I'm going to spend my time with you sharing some highlights of that report. It's also my understanding that you have access to that report in your library. I tried to give all the resources that I could for you to be able to reference at a later time. You also have some handouts that I think that are really helpful. You have an issue brief from SAMHSA, and then you have the two most recent fact sheets from the state of Illinois, published by the Illinois Department of Public Health on youth suicide data. It's what we have available to us at this time. So we know that the statistics are heartbreaking and they're alarming. Researchers found that the suicide rates among Black youth ages 10 to 17 in the United States between the years 2007 and 2020 rose by 144% between the years of 2007 and 2020 in this country. We're going to take a look at a few additional statistics. In 2020, for the first time, the suicide rate among Black youth ages 10 to 19 surpassed that of their white peers. While white youth suicide rates decreased by 17%, Black youth suicide rates increased by 54%. These numbers represent shattered dreams, silenced voices, and futures that we just cannot afford to lose. Black LGBTQ are also at a particularly high risk. And we see that there's a gender disparity as well within these statistics. According to the Centers for Disease Control, Black boys ages 0 to 19 have more than twice the suicide rate compared to Black girls of their age group. However, the crisis affects all Black youth. So the statistics that I'm sharing with you now are death statistics, but we also are very equally concerned not only about the Black youth who die by suicide, but the Black youth who are living and what we can do to support them. Data from the 2021 Youth Risk Behavior Survey showed that 1 in 5 Black high school students reported seriously considering suicide, nearly 18% made a suicide plan, and 15% reported attempting suicide. So these statistics present a stark picture, but it is important for us to remember today that behind each of these numbers is a young life, is a family, is a community in crisis.
First, I'll start by letting everyone know what the summit is that we're talking about. And the summit is what we put together every year for our Early Childhood Leadership Academy. So the Early Childhood Leadership Academy is composed of all of the alumni fellows from our programs that we've had over the years. Most recently, the more active fellowship programs that we have are the Barbara Bowman Leadership Fellows Program and the Executive Fellows Program. We bring them together every year for a summit. And it's an opportunity to bring not only those alumni together to solve a problem, but to also invite our community partners and our peer advocates. In the past, we focused on things like
Environment.
Environment.
We talked about the environment.
Food security.
Yes.
Public health. And it's been really good because what we're able to do is get them to come together and identify root causes. And then hopefully it inspires our leaders to come up with some solutions and actually execute some policy changes. We wanted to do something in line with what Erikson has been kind of doing and what, quite frankly, all of Illinois has been doing and within the early childhood sector as well. And we wanted to focus on mental health. And in particular, we wanted to focus on this issue of Black youth suicide. So we were inspired by last year, Erikson held a series of professional development workshops for its all-staff meeting. And during that all-staff meeting, there were a lot of topics surrounding mental health. We even had a special guest come in and help us meditate. We saw that individual come back again for our luncheon that we had later in the year. And at the luncheon, the topic was mental health. It was really impactful, and it really set the tone for what was coming next. And the special guest that we had at the luncheon was Ashley Judd. And Ashley wasn't able to join us in person, but at the same time, the video that she submitted was so impactful, and I think it allowed her to dig even deeper to give her own personal story.
And I think that might have been my favorite moment from the annual luncheon because in addition to talking about mental health, specifically she talked about mental health in early childhood and the importance of it and the potential consequences when mental health needs for young children are not met. I thought that choosing the topic of mental health, I think, is really important right now, considering all of the things that happened with the COVID pandemic and all of the stress and strife we've gone through getting back to what some people would call normal, which hasn't necessarily happened for everybody yet. We live in a society that is really had a lot of amplified mental health struggles. So having mental health be the topic for our summit and then for the annual luncheon, I think was very timely and very sensitive to the needs of what's going on with children and families right now.
Absolutely. And what came out of the all-staff meeting that we had was the fact that the staff came back with, whoa, there was this session that was about Black youth suicide. So we thought, why not make that the topic? Let's invite this Tandra Rutledge back and see what she's got to say to our fellows and see if we can't get them to tackle that as an issue this year.
Right. I think it was a really good marriage of us creating an opportunity with the summit to have a lot of leaders and very smart people come together to work on a problem, and Tandra coming to us with the problem of Black youth suicide, needing people to put their energy towards that because they are looking for more support. And in response to the Sounding the Alarm report from the Black Caucus, they have put forward a task force to address the issue in terms of not only saving the lives of children, which is critically important, but also addressing the huge impact that mental illness and youth suicidality have on communities and families.
So I guess the question would be, since our catchphrase is finding the baby, how do we connect this to finding the baby? How do we find the baby in this problem? Why is it important for us to consider the baby if we're talking about youth?
And I think this is something we hear a lot working in the circles that we do, because Erikson is an early childhood organization doing a lot of work in early childhood. In policy and leadership, we're not working directly with children and families. We're working with leaders and community partners. And what we come across very frequently is people saying, well, I'm not in early childhood, so that's not really for me. I'm not interested in that fellowship because I don't have a child, or I'm not a teacher, things like that. And this is a great way to illustrate how most of the people I think in that room were not directly involved in early childhood, but they were all able to make a connection because our whole Find the Baby philosophy is centered around whatever issue there is, whatever's going on in a community, there's a baby in there somewhere.
Absolutely.
There are babies who are in families who are impacted by suicide and mental health problems. There are children and youth who, if given the proper resources and care earlier on in life, and I don't just mean family care, I mean community care, if they and their families had had access to more appropriate care, they would not be in the position necessarily to be facing suicidality. And so we find the baby by identifying, can we take care of babies in a way that prevents or solves the problem? Or if we have to intervene, how do our interventions serve entire families from the babies on through the generations? So there's a baby opportunity in every single issue, including this one. And it's a tough issue, and one of our fellows brought this up. It's very hard for people to think about young children considering suicide. It's a heavy topic. It's something that, really impacts people deeply, either because something that happened with a loved one or something that happened with themselves. It's very hard. And yet, we did hear from one of our partners that there are also young children who do contemplate suicide. And because it is so difficult to talk about, I think it's even more important for us to bring the issue to the forefront, because if we don't talk about it, if we don't face it, we can't solve it.
I think that messed me up the most to hear that, to learn that, very young children can contemplate. Because often they don't even seem like they understand that they could be hurt. So how do you contemplate at that young age?
Right, and this is really challenging, and because my background is in early childhood, I am an alumni of Erikson Institute with a master's degree in child development, and I've spent time as a preschool teacher and as a coach in preschool classrooms, literacy coach, things like that. I've spent a lot of time around young children and have seen firsthand for myself the ways that it's very difficult for people to face young children's emotions. We have a cartoon commercial in our heads about how children behave and that they're always happy, and it's like, rainbows and bright colors. Children have all the same emotions that we have, and if they are put in difficult circumstances, they, in their own ways, which may be different from adults, but again, they're working with the same equipment and the same emotions. In their own ways, they're going to face, sadness anger, frustration, despair, and if we want them to have the childhoods that we'd like to imagine for them, then we're going to have to acknowledge the problem and face the problem.
So let's talk about some of the connections that were made, because I'm sure there's some listeners who are thinking, yeah, but okay, so how do you find the baby in these different sectors? I mean, one of the things that I can think of is transportation for families, right? How do families make it to these appointments, right? How do they get these services? And transportation is a huge issue.
That's a great point.
You know, from the communities that they're in. How often do the buses come through? And
Absolutely.
If I'm in transportation, I want to see about, okay, let's make sure that these families can get to these locations, right, to these services. What else do you think?
That makes me think, taking it a step back, still thinking about transportation, but also thinking about how do people who are impacted by transportation in other ways end up with mental health crises. A lot of people experience distress over not being able to have income through being unemployed.
Absolutely.
A lot of unemployment is caused by not being able to get where people need to go, or people have to choose between food and transportation,
That's
or
right.
childcare and transportation, or one person gets to have transportation to their job because they make the most money, but the other person doesn't get to.
Absolutely.
And it's very hard to make those choices. One of our community partners is Birth to Five, and they have a series of reports on the different regions in the state of Illinois, and they talk a lot about those kinds of issues, and those different sectors do come up. How is employment impacting my ability to get my kids into daycare? How is getting my kids into daycare impacting my ability to stay employed, and so on and so on. And this is why finding the baby is so important, because all of these issues are interconnected.
Absolutely.
And something I want to really make clear for our audience, in our Early Childhood Leadership Academy, during our ECLA fellowships, we encourage our participants to, quote unquote, find the baby in whatever they're doing, whether it is early childhood related, whether it is government related, whether it is healthcare, because the baby exists in all of those spaces. So this was a great opportunity to help people find the baby in mental health in a way that we maybe haven't talked about as much.
So it was really great because we had some of our alums volunteer to talk about how their work might impact this issue.
And because our fellows and community partners operate in multiple sectors and many communities across Illinois, they were able to also make connections into the ways that these issues are coming up in other communities, not to take away from what's going on with Black youth mental health, but also to say we can work together because we're all facing issues. How can we put our resources together? How can we engage this wide network of professionals and leaders across sectors to make the most of solving this problem? Here is Tandra again talking to our summit attendees about powerful community-led solutions to this Black youth mental health crisis.
Absolutely. I'm so glad you shared that. He said, what does every community have? Grandmothers. And he trained grandmothers to have conversations with people. Y'all, it ain't that hard. It ain't that hard. And I will share that work is here. That peer model has been brought to Chicago, right? And so I think it was the University of Chicago working with some organizations in our area through a grant to try to implement that peer model. They trained some regular people to be embedded in community, right? There is work here that's being done. How does that get elevated for impact?
And what I really appreciate about working with Tandra Rutledge is that she brings this issue forward. She acknowledges the heaviness of it. She acknowledges the deep impact that it has and the tragedy, all of that. But she also has a very joyful approach to talking about it and bringing other people into the topic. Let's hear once more from Tandra Rutledge about how we get these youths to a place of thriving.
So It's important for us to think about risk factors, but it also is important for us to highlight protective factors, because despite those challenges, there is hope. And what we can do is we can leverage the inherent strengths within the Black community to prevent suicide. And some of the ways that we do that, and that is included as well in the reports, is to strengthen family and community connections, fostering a sense of belongingness. Our work is far, far, far from over. In fact, we are just beginning. What we realized in Illinois is that we have no foundation. We have no existing structure in place to even begin to address this issue in our state. But our resolve is strong, and our commitment to this work is strong. Our success in Illinois will depend on securing funding to help us to implement an effective and culturally sensitive plan. We need you to advocate for increased funding for Black youth suicide prevention research and implementation in our state. We need you to support initiatives that will create safe spaces for Black youth. We need you to promote culturally competent mental health services and reduce stigma. We need you to engage policymakers to prioritize Black youth mental health. If you are a mental health professional, we need you to seek training in culturally responsive care. If you are a medical provider, we need you to seek training in culturally responsive care. If you are an educator or a community leader, we need you to implement evidence-based, culturally responsive suicide prevention programs. And we need you to engage the Black church in suicide prevention initiatives. Everyone in this room has a role to play in preventing Black youth suicide. And that's what this summit is all about, right? Taking actionable steps to ensure that every Black child in Illinois knows that their life matters and that help is available. And together, only together, can we turn the tide of this crisis and create a future where Black youth not only survive, but they thrive.
Penny Smith here. I want to say thank you for listening to Get on the Early Childhood Bus. I also want to share some news with you. I will be leaving Erikson Institute, and I want to express my gratitude to all of you for supporting our podcast. Every time you have listened to, shared, or downloaded Get on the Early Childhood Bus, you have helped us in our mission to find the baby in different social sectors and disciplines, extending our reach as we connect with leaders across the state of Illinois to support improving conditions for young children and their families. It has been a pleasure to bring this work to you through the lens of this podcast, and we hope you'll find the baby in all that you do. This is Penny Smith, signing off.